Now, I want to ask another question that I personally think is really important for us to discuss because I want to make sure that we are sending accurate messages to our trainees. Specifically, being in academics for some number of years now, I've heard on a number of occasions, even a few times within the last year, academic radiologists send some caution to trainees that entering teleradiology straight out of radiology residency or fellowship may not be ideal for reasons that typically center around maybe a lack of mentorship in the teleradiology environment for newly minted radiologists, or perhaps an inability to get an additional opinion if a new radiologist is looking at a particularly challenging imaging study. Are any of these concerns valid? And especially, what is your perspective on newly minted radiologists entering teleradiology straight out of training?
Well, that is a good question, and it is a legitimate concern in teleradiology in general. It is actually not the case at vRad. First of all, I would say I didn't receive any mentorship when I went to private practice. I had no interactions that I would have called mentorship. I had some collegial interactions with other folks, but I did not have a role model or a coach of any kind. And it didn't seem to be my lack of receptiveness. It just seemed to not be part of the culture at all. So I think the idea that any other practice you go to will have mentorship is probably illusory. I would also add that interpersonal interactions on site are not the highest quality of interpersonal interactions. You're dealing with technologists you didn't hire, with partners you didn't choose. There are all kinds of interruptions and distractions. I've listened to people yell at their spouses on the phone in the cubicle next to me. I've listened to people plot their fantasy football rosters. All interpersonal interaction is not necessarily desirable. And if you take those energies and put them into spending time with your friends and family, people that you did choose and do choose to spend time with, I think it's much better spent there. But to move on to why vRad is different, we recognized that, hey, perhaps isolation or the lack of mentorship might be an issue. We realized it a very long time ago, and we built appropriate systems and processes to accommodate that. So when we hire a new radiologist, we assign them a radiologist advisor. They help with the workstation training. They go through your practice cases that we give you to grade your reports and give you tips on that. They're there to review any quality assurance issues that come up during your first 3 months, and they're always available for questions. So we have a mentorship program actually formalized at vRad. In addition, we have a teaching file built into our system so that anyone can save any study to a vast repository where we then select those cases for our educational materials. It's a reference for our radiologists, so there's always a vast array of studies that can be referenced for educational purposes. We have embedded StatDX into our system, which the folks at Elsevier told me we're the only practice in the country, right? Because, of course, we have the software engineering capability to do that. So we have StatDX right there, ready for reference, that gives you a 0.5 CME per search as well. So we have built all kinds of processes into our systems that enable the radiologist to interact, to address this mentorship issue, and for that matter, the interpersonal interaction issue. And the other thing, we have a consultation engine built into our platform. So if you have a question about a study, you can simply hit the consult button and you will be given a list of every radiologist that's online at the time. I mean, if you get on at midnight on a Friday night, there will be at least 200 radiologists also online, listed with their specialties, and we also even list the number of consults they've taken in the last few hours so that you can see if someone's been carrying more than their load. And so you can send out invitations. You can send out as many as 6 invitations at once. And those people all get a nice baby blue tab and a soft ding. And when they have the opportunity, they can click on that tab and take the consult. So you rarely wait for more than a minute. And when someone accepts your consult, it will open a mutually controllable viewer window where both of you can annotate, scroll, and chat back and forth. So it's easy as scrolling up to the level, putting an arrow on the thing and saying, what is that? And so people are very collegial at vRad. There's no such thing as dumping on one another because we pay on a productivity basis. And so if you don't read a study, someone else reads the study and they get paid for it. So there isn't any of the acrimony that can arise from unequal contribution, which I saw as a common issue with the cultures on site.
Yeah, I like the example also how you use your systems to provide consultations and help radiologists be able to do their job better. That does provide some reassurance in my own mind that new radiologists entering vRad do have a helpline readily available, it seems. If they run into a case that's challenging, you guys certainly, it doesn't sound like, leave them on their own to figure it out without any support. So that's great.
Yeah, it is neat. And I would say too that the younger generation just loves vRad. They thrive here because they understand the advantages of technology. They seek it out. And they also are of a mindset that they want flexibility. Flexibility of all kinds, geographic flexibility, scheduling flexibility, workflow flexibility, and we're able to deliver on that. So I think there are a lot of positives to just coming straight out of training and going to teleradiology. In fact, a lot of the complaints that I hear from the older radiologists that come to us, probably the most common regret is they all say, I wish I'd done this sooner. So you can't do it any sooner than right out of training. And then you'll have no reason to look back with regret.
And along those lines, about living life without having any regrets later on, what is your advice for current radiology trainees in terms of selecting their first job straight out of training? How can they get it right? It's a big decision. What advice do you have?
Well, it is a big decision. And I truly feel that teleradiology is a great first option. Again, you don't want to have regrets. But I would add a couple more practical things. I think one is I think there will be a greater division between diagnostic and procedural radiology as time goes on. Especially since COVID, there's been such a shift towards teleradiology and a much broader acceptance of it as a legitimate entity. So I think that it's going to separate from the procedural aspect significantly. And I think that when you look for a job in this day and age, you should probably be deciding for yourself which of those you want to pursue, because you're going to have to pick one path or another in the coming decade. I also think that it's advantageous. For one thing, it enables teleradiology much more, right? It's, again, more broadly accepted, it'll be more widely utilized. But I also think that was one of the things that drove me from private practice as well, is the expectation that you perform both your diagnostic duties and your procedural duties simultaneously in your on-site workflow. I found that terribly distracting, constant interruptions with regard to your ongoing procedures, and always trying to just knock out one or two more diagnostic studies before the next biopsy comes. It was terrible, and I always felt that I did a less than good job at both because I was required to divide my attention and energies. And so if you can just focus on one aspect or the other, I would say do it. I haven't held a needle in 16 years now. And the one time I have held a needle in the last 20 years was to put an IV in a guy on a plane. So I don't miss that aspect. I find the diagnostic to be the cognitively challenging and professionally satisfying aspect of radiology that I'd always wanted. I actually don't have more advice on picking your first job, but I do have advice on picking your second job.
Okay.
One thing I've noticed is that all the practices that are offering any of these various models, private practice, academics, teleradiology, they are very much the same. Now, I will make the exception to say vRad is entirely different from every other teleradiology practice out there. But generally speaking, with that exception, I view the basic models of academics, private practice, and other teleradiology practices as being fundamentally similar. And so if you find yourself unhappy with your first selection, whichever of these it is, change models. If you join a private practice and say, I don't like this private practice, we're treated unequally, other people are making more for less effort, the efficiencies of the workflow are abysmal, don't think that you can find a private practice that solves those problems. You might think you did, but you'll go to that other private practice, and 2 years later, you'll look around and say, well, I'll be. This is just like it was. They present themselves differently. They hide or shield their flaws in different ways, but ultimately they are fundamentally very similar. So if you find yourself in a private practice where you are unhappy, then I would say try academics or try teleradiology, right? But don't move around within the same practice model because you'll probably find the same problems.
Yeah. There's a large percentage of radiologists who do switch jobs within their first 3 years after training. That did apply to me as well. And I can say that it is the second job where you have a lot more insight into what you actually like in radiology and what you're truly looking for. So that makes sense to me. I do want to circle back really quick and ask you, do you think when you say that in the future diagnostics and procedures will increasingly unbundle, does that apply to breast imaging too, or is breast imaging perhaps an exception?
Yeah, I would agree with you, Matt. I think that probably those will remain bundled, as you say, in mammography. That does make a lot more sense.